Coming to our previous year NEET question series, this is question number 39. This is also a question on lung cancers. An elderly male who is a known smoker presents with significant weight loss, chronic cough and fatigue. Serum calcium level is raised. A lung biopsy was done. It showed large atypical cells with hyperchromasia. What is the probable diagnosis? Okay, so we'll note down the clues here. He is a smoker. He presents with weight loss, chronic cough and fatigue. So whenever there is significant weight loss, the first thing which should come in our mind is definitely cancer. So we are dealing with some kind of cancer. Serum calcium level is raised. So there is a cancer, probable cancer, with an elevated serum calcium level. So whenever we think of the word calcium, always remember there are only two very, very important causes. Of course, there are many causes, but you must remember two important causes. One is primary hyperparathyroidism, where there is elevated parathyroid hormones levels. Primary hyperparathyroidism. The second cause is hypercalcemia of malignancy. This hypercalcemia of malignancy can occur due to many reasons. One, it can cause bone mets. Second, without bone mets, the tumor can secrete a parathyroid hormone related peptide, so which acts like hyperparathyroidism to drive calcium out of the cells, because one of the actions of parathyroid hormone is to bring calcium from the bone into the blood. So then some tumors occur in the bone itself. For example, bone-based tumors are the famous myeloma, because it then comes from the bone marrow, so it erodes the bone. It leads to hypercalcemia. So these are the two important causes of hypercalcemia. We have other causes also like sarcoidosis, vitamin D toxicity, etc. But these two are the most important causes. And in lung, we have 4 cancers. Small cell cancer of the lung, squamous cell cancer, large cell cancer, and adenocarcinoma. Adenocarcinoma of the lung. Of these, small cell, squamous cell and large cell, these are smoking associated tumors. Adenocarcinoma of the lung should be suspected in non-smokers and in females. So this history gives a smoker, so it should be one among these 3. Small cell cancer is very important, especially for MCQs, because it is very well known for its paraneoplastic manifestations. Many paraneoplastic manifestations occur in small cell cancer of the lung. For example, if there is hyponatremia, we can think of SIADH. This tumor secretes ADH, causing hypernatremia. Then this tumor can produce erythropoietin and cause polycythemia. Then we have Lambert-Eaton myasthenic syndrome, where there is antibody against the voltage-gated calcium channel in the presynaptic membrane, which causes weakness, mimicking myasthenia gravis. So most of the paraneoplastic manifestations are associated with small cell cancer. Only one paraneoplastic manifestation is typical with squamous cell lung cancer, that is hypercalcemia, because the squamous cell lung cancer secretes parathyroid hormone related peptide, which acts like parathyroid hormone to cause hypercalcemia. So in lung, if there is hypercalcemia, the cancer which we must remember is squamous cell cancer of the lung. So coming here, large cell cancer is a neuroendocrine like tumor. So there is a smoker, there is a cancer. So all the 3 are possible: small cell, large cell or squamous cell. But since there is the clue of calcium level is elevated, the answer is squamous cell cancer. But don't get confused with this term, large atypical cell with hyperchromasia, because this is a very non-specific finding, because whenever there's a cancer, there will be atypical cell, there will be hyperchromasia, there will be hyperplasia, there will be loss of orientation. So they didn't give any other cells, because only on doing immunohistochemistry we can find out the particular type of the cancer. They didn't give much of the details. So with the available detail, I think squamous cell lung cancer is more likely than large cell cancer. Okay.